Welcome to the Nutrition Research Update from the Renaissante Institute of Integrative Medicine. I'm Dr. James Machino. Our topic today is tension headaches. Now, a tension headache or a tension type headache is the most common type of headache. It's 90% of all the headaches that people get. And about 3% of the population suffers from these chronic tension type headaches. Now, the pain in a tension type headache usually begins sort of at the base of the skull and sort of the upper part of the neck, and it comes over the head and often reaches the eyes and around the sinus areas, or it can go to the side of the head as well, even towards the ears. How does it feel? It's usually constant pressure. It feels like the person's head is being squeezed in a vice, and it's usually on both sides of the heads at once, whereas a migraine is usually only on one side. And the severity is usually mild, moderate, and it's rarely severe. So usually these are not, headaches that are incapacitating, but they're nagging and they can interfere with your quality of life and your productivity. And unlike migraine headaches and brain tumors, usually the pain is not a headache pain that you wake up with. When someone has morning headache pain, that's a little bit more alarming. That can be a migraine. You also have to rule out brain tumors when it comes to morning headache pain. That's usually not the case with a tension headache. The duration, usually a tension headache lasts 4 to 6 hours, but again, that can vary. What's important are, what are the triggers of these tension headaches? Well, it can be when you're feeling under stress, or you've been under stress for a long time, then the stress sort of dissipates and then the headache hits. Or sleep deprivation is a common trigger. Being in an uncomfortable position for a long period of time where your head or neck is in sort of an awkward position or using bad posture, that can trigger it for people who are susceptible. And irregular meal timing, where there's a drop in blood sugar or a major fluctuation in blood sugar, because the brain depends so much on blood sugar, it might trigger it in someone who's susceptible. And eye strain can be a factor. Sitting at that computer terminal for a long period of time, for some people can trigger it. Now, there is a common underlying cause for many tension headaches that people experience, and the underlying, predisposing factor for a lot of people is that they have pressure just underneath the skull on the nerves that are exiting right there. So there are nerves called the greater and lesser occipital nerves. And they actually leave the spine right at the back of the neck, and then they actually come back up over the head, and then they connect with nerves that are on the front of the face, and so you get this sort of spillover effect where the pain can keep spreading because of this sort of communication or this synapsing with what are called the cranial nerves. And these nerves can come to the forehead, the side of the head, around the eye, or to the sinus area. And so very often what makes a person susceptible to tension headaches in the first place, forget about the trigger factors, what's actually the root cause, is that there's misaligned vertebrae or spinal joints around the upper neck area, the first cervical vertebrae, the second cervical vertebrae, the third cervical vertebrae. When they're misaligned, they can irritate the nerves that come over the head. And when there's just low-grade irritation, then there's no headache. But all you need is for those muscles around it to tighten up just a little bit more, or for your blood sugar to drop, or for your eyes to be strained, or get into an awkward position. Next thing you know, you have a headache. So when you have these misaligned vertebrae or spinal segments, often the muscles around those nerves also start to tighten in what we call the suboccipital triangle area. And then those nerves get squeezed, they release inflammatory chemicals that amplifies the pain, and then you're into the cycle where it's going to last a number of hours. So the standard medical treatment for these types of headaches is to give people, pain medication to sort of, mask the symptoms, but it doesn't really address the underlying cause. And if you're using, these drugs like aspirin and ibuprofen and, Motrin and Tylenol over and over again, then you risk internal bleeding, and stomach irritation, and liver damage, kidney damage, which accumulates over your lifetime. So just relying on those drugs is not the best answer. Using drugs like Furanol and other narcotic type drugs, can actually create an addiction potential and personality changes and other complications. And the more serious drugs like tricyclic antidepressants, they might work, but they also have undesirable side effects. So these are things that you want to try to minimize or avoid as much as you can. Recently, they've tried injecting a botulism toxin into the muscles and the nerves with mixed results, and even then, I'd say that's not the first thing you should do. When you're a person that suffers from these kinds of tension headaches, the first thing I would do, because I've seen it work, is you get to see a chiropractor who can address, is there nerve pressure happening in the suboccipital triangle area? Because if a chiropractor finds that they can realign the segments and take the pressure off the nerves, if that's what's happening, they can also address the muscle problems and strip out all the contractures and the trigger points to stop the amplification. And using sometimes some traction, you can open up the area where the nerve roots are traveling, take the pressure off them. And even electroacupuncture can be highly effective. Even manual acupuncture can be very useful. Studies show that these types of treatments are very, very effective. And in conjunction with that, then a chiropractor would help you identify what the triggers are in your lifestyle to try to help you reduce stress. If you're at your computer monitor, you might want to get a larger screen or take some breaks so there's less eye strain. Help you with sort of blood sugar stabilization, which we'll talk about in a moment. And you should also make sure you're getting enough sleep. So you can help to manage it using these proactive things in conjunction with chiropractic care to realign the segments. Now, the use of targeted nutrition and supplementation management is also very highly useful as part of the long-term strategy. You need to prevent low blood sugar states from arising, usually using small, frequent meals and foods that are not too glycemic, as we say. The use of endurance exercise is helpful. It improves insulin function in the body so you don't have the big sweeps of blood sugar. It also helps to reduce the secretion of stress hormones, which can be a factor in triggering the headaches, as we said earlier. And then there is a combination supplement that contains two herbs, feverfew and butterbur, which have been shown to be very effective in migraine headaches, but they may also help in sort of tension-style headaches as well. Certainly worth trying. And there are anti-inflammatory supplements. If there's been a lot of inflammation around those nerves for a long time, the combination of curcumin with boswellia, with white willow bark extract and ginger, that type of combination supplement used for a short period of time can bring some of that inflammation down and help to even manage it on a long-term basis using a very low dose. These are very non-toxic herbs that don't damage the stomach or the kidneys or the liver. And of course, using the right combination of essential fats, a combination of flaxseed, fish oil, and borage seed oil altogether produces anti-inflammatory hormones in the tissues of the body to suppress the inflammatory process, which is often a factor in many types of headaches. And with that, you need a high-potency multivitamin with enough of the B vitamins and antioxidants because they suppress inflammation, and the chromium will help to regulate blood sugar better. So you get this synergistic effect. So what I've done, because this is the part that's not known really well, is in the text below I've shown you the exact nutrition and supplementation recommendations that are helpful for individuals with sort of tension headaches. So if you have a problem like this, I'd say try to follow the practices that I outlined here. See your chiropractor, put the nutrition and supplementation practices into place as I've outlined them in the text below. And if you know someone who suffers from tension headaches, then I would suggest strongly that you forward this nutrition research email video to them so they can get some information for themselves that may be helpful. So I hope you found this useful and informative, and I thank you so much for watching, and I'll see you next time.